Hi, my name is Taimur Ali Khan Malik, and today I will be doing a club journal presentation. So, my topic is tuberculosis in Pakistan. So, just a brief introduction of tuberculosis. That tuberculosis is an infectious disease, and it spreads by an organism called Mycobacterium tuberculosis. So, it's an infectious disease, and it mostly spreads through contact, means through sneezing, through coughing, and the particles go in the form of droplets into the air and spread to other individuals. And the area of the body that it affects are the lungs. So it is a contagious disease, and it is the most common cause of deaths, so killing almost 2 million people annually all over the world. So, so if we talk about Pakistan with reference to tuberculosis, so the burden of tuberculosis in Pakistan is sixth in the world. So it is the sixth highest TB burden country of the world. So according to WHO, there have been different estimates for incidence of tuberculosis. So the incidence of tuberculosis is 230 per 1,000 individuals. The prevalence rate is 310 per 1 lakh individuals, and the mortality rate is 39 individuals out of 1 lakh individuals. So it's a sector in which Pakistan has to improve to reduce the number of TB cases. So in this presentation, as we have discussed the high burden that tuberculosis remains a significant public health issue in Pakistan and accounts for approximately 5.8% of the global TB burden, with over 5 lakh new cases reported annually. So the public health impact is Pakistan is one of the 30 countries with high TB burden, and the disease is a leading cause of mortality and morbidity, particularly affecting vulnerable populations such as children and individuals with weakened immune system. So there are different challenges due to which TB is spreading in Pakistan that fast, and the different factors contribute to this thing. So the country is facing challenges in TB management, which includes drug resistance, delayed diagnosis, and limited access to healthcare in rural areas that are exacerbating the disease spread and impact. So if we talk about the objectives of this presentation, so first of all, there's a critical appraisal to critically analyze selected peer-reviewed articles on TB in Pakistan, focusing on the methodological rigor, validity of findings, and implications for public health practices. Second is the application to practice to explore how the findings of these studies can inform and enhance TB management strategies in Pakistan, addressing both clinical and public health perspectives to reduce TB incidence and improve patient outcomes. And the third one is global and local relevance. So, to contextualize the findings within the global fight against TB and Pakistan's specific epidemiological and socioeconomic conditions, highlighting areas for intervention and policy developments. So, these are the objectives of the presentation, which we will try to cover. So the articles overview, I will give a brief overview of the articles. So the first article is safety and immunogenicity of a thermostable ID93 plus GLA SE tuberculosis vaccine candidate in healthy adults. Evaluates a phase 1 trial assessing the safety and immune response of a thermostable TB vaccine. The study finds the vaccine well tolerated with a stronger immune response than the non-thermostable version, though limitations include a small sample size and a short follow-up. The second article is the transmission of tuberculosis in an incarcerated population during the subclinical period, a cross-sectional study in Qingdao, China, and that exposed TB transmission among prisoners, revealing a high infection rate of 23.32%, with a significant portion being subclinical cases. The study underscores the need for better active case finding in such high risk environments. So, the third article is isoniazid and rifapentine treatment that effectively reduces the persistent Mycobacterium tuberculosis infection in macaque lungs, because there's an issue of drug resistance with respect to tuberculosis. So, The trials have been done on some species of monkeys to see what will be the outcome of those. So uh, this shows a treatment regimen that significantly reduced TB infection in macaques. However, the applicability of these findings to human populations remains uncertain. So then we will move to the relevance to clinical practice in Pakistan. Like the first one is safety and immunogenicity of a thermostable TB vaccine. So the findings highlight the importance of developing vaccines suitable for Pakistan's challenging logistics, where maintaining a cold chain storage is difficult. So making a thermostable vaccine is highly relevant. And second one is transmission in incarcerated populations. So this study underlines the need for improved TB management in Pakistan in overcrowded prisons, where high transmission rates could exacerbate the national TB crisis. So third one is isoniazid and rifampicin treatment. Effective treatment strategies for persistent TB infections, such as those studied in this article, are crucial for combating drug resistance TB in Pakistan. So number four is pediatric TB epidemiology. As discussed in this review, undertaking the high burden of pediatric TB in Pakistan is vital for developing targeted public health interventions. So we have got some research questions, and I will give a brief summary of those research questions. That thermostable TB vaccine. So the research question development sought to determine whether thermostable tuberculosis vaccines are as safe and effective as conventional vaccines while filling a gap in vaccine handling. Then persistent TB infection treatment. The question of interest was whether isoniazid and rifampicin can effectively prevent recurrent tuberculosis at all, which has direct implications for the drug resistance tuberculosis epidemic in Pakistan. Then TB transmission in prisons. This study examined how non-symptomatic tuberculosis patients contribute to overall incidence of tuberculosis transmission in high risk settings such as those common in Pakistani prisons. Then pediatric TB. Against this background, the study examined pediatric tuberculosis epidemiology and risk factors to improve diagnosis and treatment of the disease in countries with high disease burden, including Pakistan. So the critical appraisal of methods. So thermostable vaccine study. Strengths include a well-controlled phase 1 trial design. Limitations involve the small sample size and short duration of follow-up. So present TB transmission study, a robust cross-sectional design with comprehensive screening methods, though limited by its confinement to a single prison, affecting generalizability. So the treatment for persistent TB, a macaque model allows controlled experimentation, but results may not directly translate to human population. Then pediatric TB epidemiology review. This review effectively synthesizes global data, but may be limited by the variability in data quality and reporting standards across different regions. Then evaluation of the results. Thermostable vaccine study. The vaccine showed a stronger immune response than the non-thermostable version, that was p less than 0.05. This result is highly reliable due to the controlled trial setting, but the small sample size limits generalizability. So the present TB transmission study, there was a 23.32% infection rate with 70.59 subclinical cases. The rigorous screening method enhanced the validity, though the single location study limits broader applicability. So the persistent TB treatment, significant reduction in persistent TB infection was observed in macaques, while promising the animal model questions reliability when translating to human populations. Then pediatric TB epidemiology review highlights under diagnosis and treatment gaps, particularly in high burden regions. Global data synthesis is robust, but the variability in data sources may affect overall reliability. So discussion application to Pakistan. So thermostable vaccine based on the findings. Case can be made for developing vaccines that do not require cold chain storage, particularly in rural areas of Pakistan with less infrastructure. Then prison TB management, efforts to implement active case investigation along with targeted interventions in overcrowded prisons promise a good impact on the transmission rates of tuberculosis, one of the major public health concerns in Pakistan. So, drug resistance TB in Pakistan, where cases of such strains of tuberculosis have emerged, the learned treatment regimen could be used to develop new approaches to managing drug resistance tuberculosis patients. And then the pediatric TB interventions. The review highlights the need for better screening and treatment practices for children, increased in the less developed areas of Pakistan, where pediatric tuberculosis is rare, but treatment is very effective. Then we will talk about the global and local implications. So, if we talk about the global implications, the studies help plan and formulate global tuberculosis policies because it's a global issue. So, focusing on thermostable vaccines and calling for new lines of treatment for drug resistant tuberculosis. Then there are local implications for Pakistan. So the study emphasizes the need for specific programs to target high-risk groups, including prisoners and children, while monitoring Pakistan's socioeconomic situation and healthcare delivery. Then policy changes. Those findings may help develop changes in tuberculosis control in Pakistan for advances in vaccine distribution, prison healthcare, and childhood tuberculosis control. Then there's clinical practice that new treatment regimen and improvement of diagnostic interventions could improve tuberculosis outcomes in Pakistan, which aligns with the ambition to eradicate the disease worldwide. Then challenges in implementation. So definitely there's a resource limitation, and the availability of fund poses a challenge for implementing the thermostable vaccine because awareness of tuberculosis is uh, low in rural areas, while access to healthcare is generally limited. So infrastructure gaps. So poor health centers in rural areas have limited the ability to provide alternative tuberculosis screening and new treatment for prisoners and children. So then there are some policy barriers that some current public health policies may not adequately address new tuberculosis interventions, including active case finding in prisoners and therefore require policy updates. So what should be the possible recommendations? As we have discussed all the things. So, in recommendations, there should be vaccine program expansion, and that we should ensure that the thermostable vaccine is administered in rural and hard to reach areas, as it eliminates problems such as cold chain and improves vaccination coverage. Then there's prisoner healthcare improvement, implement appropriately designed tuberculosis infection control and treatment policies in prisons, emphasizing active case management to reduce the risk of transmission. And then there is pediatric TB focus to expand pediatric tuberculosis diagnostics and treatment services, focusing on the current gap to meet increasing needs in high burden settings. Then there are policy reforms, a campaign to revise guidelines to incorporate a new treatment regimen for TB into Pakistan's national TB control programs. So, at last, we will try to talk about the conclusions. Um, in the start, we discussed about the TB. Then we have discussed the different peer-reviewed articles with reference to Pakistan, that how the findings of those articles can help to improve this situation in Pakistan. So the critical findings that we have gathered is the topics that we have discussed is they have addressed and supported in the studies include, but are not limited to, thermostable vaccines, better tuberculosis in prison, uh, uh, effective drug-resistant tuberculosis, and tuberculosis in children. Then evidence-based strategies increase the call for research-based practices to reduce the burden of tuberculosis and improve the health of Pakistani population. And at the end, there's definitely call to action to recommend the application of these findings to Pakistan's current tuberculosis control program. Only this way we can improve what's going on in the health sector with regards to TB management. So, personal decision is decision to implement. I will adopt the thermostable vaccine and enhance TB management strategies in prisons. And then supporting evidence, the thermostable vaccines' proven immune response and the high TB transmission rates in prison justify their use in practice. Then relevance to Pakistan, these strategies are particularly crucial given Pakistan's logistical challenges and high risk prison populations, making them essential for effective TB control. And then at the end, there are references. Thank you very much. Thanks a lot.